All right, good day, everyone. Imagine two people facing the same problem. The first person encounters the challenge, breaks down, cries, and begins to wonder. The second person picks up himself, wipes the tears, began to think about how to navigate the problem. So the two of them have the same challenge. But what is the difference? Different mind, different mindset, different perspective. And that difference is what we call mental health. Whether you realize it or not, whether you know it or not, mental health continues to affect how we relate with life, how we encounter situations. My name is Dr. Elizabeth. I'm a mental health doctor, and today I want to explain mental health in a very simple, relatable term using what we encounter every day of our lives. So, when we talk about mental health, we're talking about how we, our mind, how we think, how we feel, how we interact with life, how our emotions respond to things, how our personality expresses itself in daily life. And so mental health is a state of well-being that encompasses how we relate with people, how we see ourselves, how we interpret life, perspective, decision making. So when the mental health is okay and stable, life feels good. When the mental health is not good, you begin to struggle with even simple things. So think about you having a phone, flashy, so good, but the memory is full and is not able to like respond or work and it starts to lag behind. That is just like mental health. So you may be smiling, everybody looks at you as beautiful, awesome, but deep inside, person may be bleeding, anxious, afraid, dealing with past hurt, not even knowing how to move on. So it doesn't mean that the person is bad, it's just that the mind is crying for help. So mental health described that by WHO is a state of well-being where an individual realizes himself, is able to cope with normal stresses of life, can learn and work productively, and is able to contribute to the society. So let's look at it. Being able to realize yourself, knowing your strength, knowing your weaknesses, knowing what you are capable of doing. When this is not there, people begin to fail at deadlines, is not able to meet up with schedules, having fear of failure, start to doubt himself, can I do this? What if it fails? What if it doesn't work out? Second part, being able to cope with normal stresses of life. We know there are abnormal stresses of life. They are so too much that one cannot even bear. But normal stresses like childbirth, taking care of a newborn, pregnancy, losing job, losing loved ones, it can be stressful, but they are normal stresses. So when someone is unable to cope, like somebody fails an exam and starts to doubt himself, can I even make it in life again? That is not being able to cope with abnormal stress of life. Some people commit suicide because they fail an exam. That is, it means the mental health is not optimal. And let's look at being able to learn well and work productively. Whatever you are doing, being able to finish a task is part of mental health. Being able to sustain what it is you are doing. You are reading a book, being able to sustain your attention, being able to think through, learn, work productively. Some people cannot stay at a job for 3 months. You just change job every 6 months, every 3 months, they are not able to maintain a stand. And this is not good. And being able to contribute to society. Society doesn't mean you want to contribute to the world. It starts from your neighbor, it starts from your friend, it starts with your siblings, your family member. Are you relevant in their lives? So this is what we talk about when we say mental health. And when we talk about mental illnesses, we are not talking about being mad. A lot of people think mental illness means the person is is mad, but that is not it. They are just like the brain. It's just like one has headache or people who are diagnosed with hypertension. The brain too can be sick, may not be able to even identify or organize itself. Sometimes people can have depression, anxiety disorder, bipolar disorders, schizophrenia, trauma related disorders, even substance abuse. All these are disorders that are being diagnosed as mental illnesses. So mental illnesses affect the brain, and it doesn't mean the person is weak, because oftentimes people think people that have mental illnesses they are weak, they are not strong, they are cursed, they are possessed, they are not responsible. It is not true. It is not true. And have you noticed that mental health even has a way of penetrating into our behavior and lifestyle? Some people behave differently under pressure. It doesn't mean they are weak. It doesn't mean they are abnormal. When people are faced with difficulties, some people start to panic, some people get aggressive, while some people become quiet and just drop everything and leave, run away from problem. While some pretend as if everything is fine. Behavior shows what is going on in the mind, and that is how our personalities are being viewed. So mental health will show and determine how balanced our personality is, whether it's balanced or not. And sometimes people that we think are wicked, they're actually not wicked. It's just that they have been hurt. And out of the abundance of the heart, the human we reflect, we produce out of the abundance of the heart. That is how we react. That is how we speak. That is where we speak from. Somebody who has been hurt, I mean, someone who hurt another person is acting out of hurt. Yes, that is what is inside the person, and that is what the person can produce. So some people are not some people are not lazy, they are depressed. But in our society we think they are lazy, they don't want to do anything, they are weak, they are prayerless, whereas depression has already set in. That is our society. That's the society where we find ourselves. Sometimes it's not just that people are proud, it shows that they don't want to think about the things that have happened in the past. The brain is trying to protect itself from being hurt again. They are protecting themselves from pain. Even our culture has a way by which it reflects in mental health, because in African in Nigeria, in many African homes, mental health is being misunderstood. If somebody cries so much, they feel like, hey, you're being dramatic, you're being weak. In fact, men are not allowed to express themselves. If someone talks about going to see a therapist, are you mad? Why do you want to see a therapist? In fact, our culture has taught us to only survive, not to heal. They say we rough we rugged we'll survive. We just want to survive at every point in time. But do we want to heal? Do we want to heal from past hurts? Do we want to heal from the pains that we are carrying around that has become a burden? Mental health exists in all the cultures, whether you're educated or not, whether you are a military or civilian, whether you are religious or not. Mental health is it is everywhere. It affects everybody, and the difference is not in the individual. The difference is in the person who has the right knowledge and what you're able to do with the knowledge you have. Because some people may even know what to do, but they don't speak out. And the reason why I'm making this video is to make it easy, make it normal for people to speak out about their mental health. But spirituality too has a way by which it is being expressed in mental health. Spirituality is a very powerful thing. Our faith gives us hope. Our faith makes us to be balanced. It gives us strength, but it doesn't negate the part of psychology. It doesn't negate health. Do you know that people can be praying, they can love God, yet they may be battling with depression and anxiety? Do you know? Do you know? So, psychology has its role, spirituality has its role. The mind and the spirit, they work together. They have their own roles and they work together. So many times you call something spiritual attack, whereas it's an attack on the mind. It's trauma that is speaking. Some people are acting out of pains, out of hurt, out of abuse of their mind. But we call everything spiritual attack. We call everything the enemies at work. So this is why I'm making this video, so that we don't just look down on what people are experiencing. Mental illnesses are real. Mental health is a big deal. The prayer has its role, medicine has its role, therapy has its role. There's a place of having good relationship. There is a place of having good understanding. So mental health is not just about talking about people that have illnesses. It is also how we express our emotion, how we believe, how we become who we are supposed to become on earth. So it is very important that we understand our mind and how it works. So on this channel, I'll be talking to us a lot more about the mind, and all the contextual factors that surround mental health, the culture, the spiritual part, psychological part, socially. All of them have their role. All of them have the role that they play. So your mind is a powerful tool for your becoming, for your health generally, for your well-being. Your mind is very powerful. And it's very important that we start to pay attention to our mind. If you read through the Bible, a lot of things are being said about the mind. That is what I've come to talk about. I hope you have learned one or two things from this video. Please subscribe to my channel and expect more beautiful and educative video from me. Thank you. Have a nice day.